While vaginal bleeding is not normal in early pregnancy, it can be common. And this symptom does not always mean there's something wrong, and mostly we can reassure our patients. However, it can be a sign of a miscarriage, and if you experience any vaginal bleeding in early pregnancy, please contact your GP, your midwife, your obstetrician or your maternity hospital for advice. We will discuss this symptom with you over the phone, give advice and organise an appointment as necessary. And if you experience pain or heavy bleeding, you should attend the emergency assessment unit in your local maternity unit. So the Early Pregnancy Assessment Service is a dedicated specialist department located on the Rotunda campus. And this unit deals with problems in early pregnancy, such as women with a positive pregnancy test experiencing vaginal bleeding, women with a positive pregnancy test to have an intrauterine device such as a Mirena or a copper coil, women who have attended another scan provider and have been told that there's no fetal heartbeat or they can't see the pregnancy, so that it's pregnancy of unknown location, and women with a history of ectopic pregnancy, tubal surgery, a previous molar pregnancy or 2 or more consecutive miscarriages, so that's 2 pregnant miscarriages that are in a row. The early pregnancy unit specialises in early pregnancy. It is an appointment-only service and we don't accept walk-in appointments. However, we have a very quick turnaround for appointments, and the appointments are generally offered within 1 to 2 weeks of referral. The emergency and assessment unit is exactly that. It should be only accessed when absolutely necessary. So about 1 in 4 pregnancies end in miscarriage. It's usually difficult to give a definite answer of why this happens. So it's important that you don't blame yourself. At least 60%, maybe even as high as 80% of miscarriages occur because of a chromosomal abnormality. And only in a small number of women with recurrent miscarriages can we give a definite cause. If recurrent miscarriage occurs, we can provide services such as our recurrent miscarriage clinic, where we'll assess and do tests to see if we can determine what we need to do for a next pregnancy. So we have a designated bereavement team within the hospital, and we have the bereavement social worker who will give counselling. We have a specialist midwife within the bereavement service, and we also have a chaplain. The early pregnancy unit team is also available, and as grief hasn't got a time limit, there's other agencies that are available, such as the Miscarriage Association of Ireland and Ectopic Pregnancy Ireland also.